Welcome to our YouTube channel Medical Subjects Made Easy. The topic today is malaria. 1. What is the definition of epidemiology? Epidemiology is the study of the distribution and determinants of health-related events in specific populations. 2. What are the clinical features of malaria? Fever, chills, headache, muscle aches, nausea, and vomiting. 3. How is malaria diagnosed in the laboratory? By examining blood samples under a microscope for the presence of malaria parasites. 4. What is the most common species of malaria parasite that affects humans? Plasmodium falciparum. 5. What is the recommended treatment for uncomplicated malaria caused by P. falciparum? Artemisinin-based combination therapy, ACT. 6. How can malaria be prevented? By using insecticide-treated bed nets, indoor residual spraying, and taking anti-malarial medication. 7. Where is malaria most commonly found? In tropical and subtropical regions, particularly sub-Saharan Africa. 8. What is the main mosquito species responsible for transmitting malaria? Anopheles mosquitoes. 9. What is the incubation period for malaria? Anywhere from 7 to 30 days, depending on the species of malaria parasite. 10. What are the complications of severe malaria? Organ failure, anemia, cerebral malaria, and death. 11. What is the specific diagnostic test used to detect malaria antigens in the blood? A rapid diagnostic test, RDT. 12. How is severe malaria treated? With intravenous anti-malarial medications such as quinine or artesunate. 13. Can malaria be transmitted directly from person to person? No, malaria can only be transmitted through the bite of an infected mosquito. 14. How long do malaria medications need to be taken for treatment? Typically, for a minimum of 3 days. 15. How can communities prevent malaria outbreaks? By promoting environmental sanitation, draining stagnant water sources, and engaging in vector control measures. 16. What are the risk factors for severe malaria? Young age, pregnancy, weakened immune system, and lack of previous exposure to malaria. 17. Can malaria be transmitted through blood transfusion? Yes, if the blood used for transfusion is infected with malaria parasites. 18. What is the World Health Organization's recommended first-line treatment for uncomplicated malaria caused by Plasmodium vivax? Chloroquine or artemether lumefantrine. 19. What is the best way to prevent mosquito bites and reduce the risk of malaria? Using insect repellents, wearing protective clothing, and staying indoors during peak mosquito activity. 20. Can malaria be prevented through vaccination? Currently, there is no vaccine available for widespread use, although several are in development. 21. What is the most effective method for controlling malaria transmission in high-risk areas? Indoor residual spraying with insecticides. 22. What are the long-term consequences of recurrent malaria infections? Anemia, cognitive impairment, and delayed growth and development in children. 23. Can malaria be transmitted during pregnancy? Yes, it can lead to severe complications for both the mother and the fetus. 24. What is the primary way malaria parasites evade the host immune system? By changing their surface antigens through antigenic variation. 25. Can mammals other than humans be infected with malaria parasites? Yes, some non-human primates, as well as other mammals, can be infected with related malaria parasites. 26. What is the approximate global burden of malaria in terms of annual cases and deaths? Over 200 million cases and over 400,000 deaths. 27. How does the Anopheles mosquito transmit malaria? By injecting sporozoites into the bloodstream during a blood meal, which then travel to the liver and multiply. 28. How can malaria outbreaks be controlled in emergency settings, such as refugee camps? By implementing prompt diagnosis, treatment, and vector control measures. 29. Is malaria considered a re-emerging or an endemic disease? Malaria is considered an endemic disease in many countries, but it can also re-emerge in areas where it was previously eliminated. 30. Are there any alternative medicines or therapies that have been proven effective for treating malaria? No, currently the only effective treatment for malaria is anti-malarial medications as recommended by national guidelines.